Okay, can everyone hear me, Ella?
Yep.
Brilliant. Okay. Hello, everyone, and thanks for joining us today. I'm Colin McGrath, a director at CXC Health. So today we'll be discussing the impact of AI and innovation in healthcare, how it's shaping clinical practice, patient outcomes, workforce roles, and the future of the overall health system. So we want today's session to be as interactive as possible. So feel free to ask questions in the chat as we go. We'll be keeping an eye out, and I'll do my best to bring your your questions into the discussion. Um, to get us started, I'd like each of our speakers to briefly introduce themselves. So maybe, Laura, let's start with you first.
Yeah, good afternoon, everyone. Nice to meet you all virtually. So my name is Laura Marcheski. My background is a registered nurse in clinical pre and post-operative care. Transitioned into a telehealth virtual role during COVID with Aspen Medical. Aspen Medical is a global provider of health solutions. I currently sit as national manager and oversee a workforce of about 250 clinicians, both nurses and general practitioners, and they provide services to government, national services, and extending to private clients as well, including occupational health. Really strong interest in governance and AI. Looking forward to the discussion today. Thanks, Colin.
No worries. Let's go on to you next, Patricia, please.
Hi, thank you everyone for joining us today, and thank you for having me in this interesting discussion. So I'm a registered nurse by background, but have been working in the digital health stream since 2012, early 2012, or e-health as we called it back then, the generation before digital health. My background has been strongly in nursing education, but was lucky to be involved in building St. Stephen's Digital Hospital, Australia's first HIM6 and then HIM7 maturity digital hospital in Australia. And then it's led me down a path of clinical informatics. So I'm really passionate about digital transformation, really considering clinical workflows together with technology, improving efficiency and patient safety, and clinical informatics being that link between technology and our clinical practice to make sure we're all speaking the same language and rowing in the same directions. I'm currently spending some time having a bit of quite a sabbatical and doing digital health consulting with a couple of consulting groups, including Evolve.
Great, thank you. And Gareth next.
Thanks, Colin. And hi, everyone. Thanks for joining. It's a pleasure to be here today, and I'm looking forward to the discussion. A little bit about me and my background. I've been back in Australia for 2.5 years now, and in that time, I've been doing quite a bit of consulting work. I'm currently a senior advisor with Boston Consulting Group, but I'm also a consultant and coach for Evolve Health Digital, and I've been helping clients like Ramsay Healthcare, eHealth Queensland, as well as the Australian Digital Health Agency, on some strategic initiatives around organisational improvement, as well as EMR selection and implementations. Before being back in Australia, I was abroad for about 20 years. I was working with the Cleveland Clinic for 14 of those years. I was a chief information officer with Cleveland Clinic in London for about 5 years, and there we opened a fully digital HIM Stage 7 hospital to support healthcare in central London, as well as a couple of outpatient clinics. And before that, I was with the clinic in Abu Dhabi for about 9 years, and we opened another 400-bed HIM Stage 7 digital hospital in the Middle East as well. Before being with the clinic, I was a consultant for about 11 years, working in both the UK, Europe, US, and Australia, doing mostly health and life sciences and digital transformation in healthcare. So looking forward to the discussion today. Great topic, and hopefully everyone gets a lot out of it.
Great, thanks, Gareth. And lastly, on to James.
Thanks, Colin. My name's James Carpenter. I'm from Evolve Health Digital. We're a small firm that focuses on providing the next generation of leaders with the tools and skills to make healthcare a great place to work. We're very focused on the transformation of workforce and how we can use tools like AI to make our lives better and our workplaces healthier and safer. Before being involved with Evolve, I worked at Gartner for 10 years in the healthcare team and was one of the sales leaders there, primarily focused on the delivery and advisory around electronic health record systems. So looking forward to this discussion, because I think the workplace is changing enormously, and digital health really gives us an opportunity to change, to evolve, and to bring new people into the healthcare system for a career that may not have seen that opportunity.
Thanks, James. And just before we begin, a quick note. Unfortunately, Juliet Graham is no longer able to take part in today's session, but we'll still be covering all the topics we planned, and she's very happy to be involved in future events. Okay, so just in terms of setting the scene, and maybe I'll throw this one over to you, Laura, if that's okay to start. How do you see AI and digital innovation currently impacting healthcare, both from a clinical and system level?
Look, the time is now in terms of transformation. I'm always hesitant to say the word transformation in relation to digital health, with the resistance you receive in those conversations in regards to challenges and known challenges of fragmentation. We are nationally at different stages of adoption, and that can be evidenced in the statewide rollouts of electronic health records, the maturation of My Health Record. And then there's point of care decision support tools, so AI driven, and then the expansion of digital health streams, so extending to pre and post care virtual EDs, and which was really helping nationally to support our diverse needs across the populations and those that need it most in our remote communities. And then from the administrative burdens in an appreciated health system, so supporting appointment management, documentation, billing, medication tracking, and then from clinical extending to remote monitoring. What we've mentioned is that decision support and those predictive analytics tools as well. So it's an evolving space, dynamic, but there is a lot of opportunity, and I think if we can do it right, reduce that fragmentation, and really utilise the opportunities in terms of providing equitable health solutions within a digital health setting.
Thanks, Laura. And Gareth, with your background, do you have anything to add to that?
Yeah, no, it's really well said by Laura. I guess some of the things that I think are really important to think about when you think of AI as well as innovation. AI is just one of the tools we have in our toolbox for innovation, and that's an important thing to realize. It's the new buzzword right now, and it's like the shiny new hammer in your toolkit, and often it's the first thing people pull out, and they want to solve every problem with that hammer, but not every problem's a nail. So AI is definitely going to solve some of the biggest problems we have in healthcare, but it's going to be one of the many things that we're going to use in our toolbox to solve some of these big challenges. And I guess it's really sort of marrying up what's the innovation or the solution we need to be able to solve the problems. And the problems we're all looking at, as Laura pointed out, is there's just a huge challenge right now with the rising cost of healthcare globally. It is just getting more and more expensive to deliver. The costs go up, but reimbursement is going down, and the need is getting greater. So how do we leverage technology and innovate to be able to make healthcare be able to be delivered more efficiently and effectively? That's one of the things that we need to think about. Another big challenge we're facing globally is staffing challenges and retention. So, we're having a huge problem with clinician burnout, and challenges with clinicians being able to manage these ever-growing workload that they have. So how do we build tools and capabilities that help our clinicians to be more efficient and effective at how they do their jobs? We're going to have to really drive efficiency, because we are creating an environment which is unsustainable for our caregivers with the burden that they're having to carry. And I guess with that, we need to look towards technology to help us deliver those.
Right.
Can,
And so,
can I?
yeah,
Oh, sorry.
absolutely.
If I can jump in there, and I just want to say to Gareth, AI being a buzzword, we have been playing AI bingo. So you can go to any conference at the moment about healthcare, and count the number of times you hear AI come up. It's definitely the word of 2025. I think there's just something else for us to really talk about in this, and it's really with AI innovation, we actually have to think about all the exciting problems they can solve, but also with a lens of awareness of our governance around it, and that we can actually introduce unknown disbenefits with introducing these tools and innovations. So a great one with AI that I think about is the source of data, and what biases do we have in our data sources that will lead, that we're training our AI and our tools on, that ultimately can lead to issues further down the track if we're not thinking consciously. Because we know in Australia, we're a great example that every health system doesn't have an EMR or capturing clinical data. We know rural and remote patients, we know lower socioeconomic patients are patients that we aren't capturing as much information. Therefore, when we're training the AI tools or think about innovation, I think we just need to be conscious of that lens as well, and not just get excited about the technology and the problems they can solve.
Okay, I've just had a question come through. Just to clarify, how do you distinguish between digital health and AI applications in healthcare? I understand AI is a component of digital health, but it's how it's typically defined across the sector. How is it typically defined across the sector? Who'd like to tackle that one?
I can give it
I'll have a go. Happy to have a go, Gareth. Thanks for the question.
Yes.
I think I agree with the essence of what you're saying, is that these sort of catch-all terms like digital health and AI, they can mean almost anything to anyone. I think when we talk about AI in healthcare at the moment, what we're really talking about is clever software and software tools that provide workflow, data analysis, any number of things, image analysis in clinical settings, decision support of all types. So, you could probably say a spreadsheet is a good AI tool in many ways, because it's given us the ability to do that in a sort of infant level. But the more powerful AI tools are going to go down those lines, I believe. Digital health, on the other hand, is the digitization of information around healthcare, and that's can be anything from the movement of information around logistics. It can be the storage of past information. It can be many things. And what we're seeing in digital health is the ability for us to provide healthcare services across digital platforms into remote locations, or locations where we're not. When I say remote, I don't mean in the desert. So I think that yeah, you're right. Healthcare AI is part of digital health, but it's a limited part.
Yeah, and also another thing I think we need to realize is that AI, even though it's the latest buzzword, and every conference you go to, at least 50% of it is dedicated to AI. AI is not new. It's just the sort of more, the more generative AI and some of the new models and ways of delivering AI are becoming more proficient and more extensively used, and that's really exciting. But AI in its earlier forms has been around for decades. I remember we implemented a command center in Cleveland Clinic, which had a single view of their 400 plus ICU beds in a single room across all their facilities across North America, and they were able to in real time monitor the status of their patients, consuming data from 20 or 30 plus data sources, including medical equipment, the electronic medical record, and others, to real time capture potential degradation of patients, through conditions like sepsis and other things. I mean, that was AI, implemented, 15 years ago, but it's been around a while. But it's just some of these new models and ways of working are obviously the exciting opportunities we have in healthcare to take advantage of.
Great.
Can I just to close on the
Of course.
digital health too? Australian Institute of Digital Health, David Rowlands produced a great paper just looking at IT, then ICT and healthcare onto what e-health it used to be called when I first started in this, and what we now call digital health, and really just defining the paradigms and the shifts that come across. And I'm just looking for a link. Crystal's just pulling up a link for that article, which might be helpful to sort of understand and explain the concept as well, and the evolution as we've come along. We'll drop it in the group chat.
Great, thank you. And maybe leading on from that, so in terms of technology changing the role for clinicians and healthcare workers, what do the panel think will be the key skills and capabilities that might be most important in the future? Does anyone want to have a... Yeah.
I was going to say, I'll jump in and start, because I think there's one myth that for people to be in digital health, they should be a tech whiz. And I, for one, I'm what I was known as technically challenged in my family, struggle to, set up a computer, use a remote control. But I have a real passion for really simple to use technology and making technology something that all clinicians can use, and it shouldn't be difficult. It should be quite intuitive. We shouldn't have to spend the hours that we do have to spend training people in our system. So I think the first thing I would call out is, I think at the moment, technology in healthcare is every clinician's responsibility and not just a subset. And whilst you mightn't specifically be in a role in clinical informatics or a team, a bit like it's everyone's responsibility around patient safety, it's now everyone's responsibility around the safe use of technology, cybersecurity, and making sure we're not causing disharm.
Do you have anything to add to that, Laura?
Yeah, only to extend. I think it's reinforcing as well with the use of AI that clinicians are still in the driving seat. They have additional tools, and it still requires those basic concepts that I think all clinicians learn throughout their tertiary education in terms of critical thinking, and also what is required in regards to aptitude and adaptability as technology continues to evolve. It was really seeing that firsthand, managing a workforce over the COVID pandemic, was that change management process, and really that was changing day to day. And the education now, I think we're seeing initiatives. The Australian Digital Health Agency has a great framework, and also Australian Institute of Digital Health has their own workforce upskilling that is free to the public as well. So I think we'll end up seeing those core subjects in tertiary for clinicians. And then also the opportunity to be able to maintain that skill set as they further progress through their careers. We're lucky enough to have clinicians that otherwise would have been lost to the profession, and have whatever challenges they may have with their health, say, we've been able to upskill them and be able to really utilise their skills still in clinical care, just in a different environment. So digitally, they're still providing the same clinical assessment. It's just been adapted to a digital environment. So it's a really rewarding role for clinicians. I think their confidence is there in the systems. We just need to be able to build that digital literacy. I think the consumer expectations are changing and what they expect from healthcare, and the technology that's provided. It's just making sure that divide doesn't increase. So it's an equitable health solution for all. And that we've got clinicians leading that and being able to be advocates and driving that change as well across the community.
Can I just add on to that, Laura, too? I think one simple thing we can all do on both sides of the fence is demystify technology and demystify healthcare somewhat. I remember our first outage I had working in IT, and having technology guys saying to me, oh, the firewall's down, and saying, oh, you're a nurse, you'll never understand a firewall. And when I just asked them to explain it, I was like, oh, this is like a calcium channel in a muscle, like in your heart. And I was able to explain the, pathology and physiology behind how a heart works. And then they talked to me about the firewall, like, yeah, it's the same concept. So I think just having that sort of shared understanding about our complex healthcare system with our IT folk, and our IT folk, leaning into share and simplify the technology understanding to clinicians, we can actually go a long way.
Can I just add one more dimension to the 2 points raised by Laura and Patricia? I think they're really, really well explained. I don't need to go into more detail. So we talked a bit about the skills and upskilling and introducing, and talked a bit about governance as well, which was great. The other thing I think it's really important to understand that needs to shift in an organisation is the culture. When an organisation shifts to become, much more digitally focused, a new EMR, new ways of working, I think people underestimate the importance of bringing the organization on that journey and shifting the culture to be ready to take on that new digital capability. So that's a skill set that's really important that sort of change management initiative around bringing the organization on the journey, communicating, making them part of the transformation and part of that innovation initiative so that they're there with you all the way, and it's a soft landing when it's deployed. People don't do that well. It's often overlooked, and I just wanted that to be part of that third dimension of the governance, the training and skills, and then the culture. Bringing those three together, if you do that well, then the transformation usually goes really well.
Right, and look, thanks everyone for keeping the chat going. You can see various documents, etc., being shared. I think you covered a little bit of this earlier, Patricia, but in terms of balancing the innovation, governance, and patient safety and ethical concerns, what are kind of some of the frameworks and principles the organization should be looking at adopting? Does anyone want to jump in there? What about James?
Look, I think there's a lot of challenges that we need to address in the healthcare system that are not necessarily related to AI or digital health. And the access to services, especially through non-cities and urban environments, is a real issue. And I think that we need to kind of support each other on how to find a way to address this with government, to change the funding models, to change the way Medicare works, to allow new technologies to be used in care much more easily. And I think that's something that I think Gareth kind of had a great point around culture, is that there is an us and them culture in the technologists and the clinicians. And digital health is a profession that is coming together, which is a combination of both. And like any profession, it has different degrees of which side of the fence you're on. But I think some unity needs to be found in order for us to find solutions that will address these issues into the far future. And as somebody pointed to earlier, the cost of healthcare globally is out of control, and the only real lever that we have at the moment is to not provide services. That's how we keep the costs down. But that obviously is not going to work for the voters out there. So those of us need to sort of think about that and how we're going to force government to adapt faster in order to keep up with the rate of change, because the opportunities that technology gives us to provide care and to improve care are so rapid now that we need to get with the program.
Laura, maybe I'll just ask you in relation to the telehealth and the demand, etc., since COVID. What's your view on that whole piece, and how's that? What's the demand like been since COVID? How's it gone, etc.? Where do you see it going?
Just telehealth nationally.
Yeah.
Yeah, I think the acceptance from a patient perspective has increased in regards to utilisation. I still think there's a divide in providing equitable solutions, so older populations and the use of digital technology as well. I think with the use and introduction of a digital front door, which we're seeing now nationally, and I think we're going to progress to, is that you just don't want people being left behind. And normally it's the ones that are left behind that are in most need, and the ones that would most benefit from some investment and being able to upskill them and have access to the technology that they need. So chronic health conditions, At the Victorian Virtual ED are doing fantastic work, and being able to have subspecialty programs in telehealth that keeps people in their homes. So hospital in the home is one. But, you know, it does require, I think, from the consumer expectation is that they are aware of the technology that is being used. So that disclosure with AI as well is really important. I think going back to the last question as well, having some sort of a framework that is understood by the clinician who's utilising the technology and where their data goes, the patient end. It sounds like simple stuff, but it's the missing pieces at the moment, and it's what will hinder, I think, in terms of the buy-in and the adaptation as the technology and the interfaces expand across the health ecosystem. But telehealth it's been particularly from ourselves an opportunity within the organisation. We've now expanded to occupational health. So that's work-related injury reporting. We have our own wellbeing app. So we noted while we were able to provide telehealth and have a large remote workforce, there was a sense of isolation among the clinicians engaging in their workplace from outside of a nursing ward environment. So we've now got our own AI tool that helps them in terms of tracking wellbeing and offering additional tools. But it's exciting, it's rewarding, it's a dynamic space. It doesn't come without its challenges. But certainly been not something I thought I'd see myself sitting in as the national manager of a virtual service when I entered nursing.
I think one of the things there, Laura touched on some great points there, and the problem we're trying to solve is access, right? It's access to care. How do we open our doors as wide as possible so we can see as many patients, you know, with the resources that we have? And the telehealth is a great tool, and we need to work out how do we use that technology to be able to engage with our patients in the right setting to deliver the right type of care. The other one is remote care as well. How do we take care of patients outside of the hospital walls? We just don't have enough beds and don't have enough space and have enough resources to be able to sort of sustain the way we're delivering care now. So how do we push care outside of the hospital walls and into people's homes, which is where people want to be? I don't know about you, but I'd love to be discharged a couple of days earlier if I could have that level of comfort that I would be safe and be able to still sustain a level of care inside my own house. And the technology is getting there. We're starting to be able to do these things, and we have a unique problem in Australia with our size and scale. We're a huge country. We cannot span those distances. People can't get access to the right facilities for all the different types of care they need. So how do we leverage technology to be able to, to support patients no matter where they are or what needs they have or how they want to access care? And we know we need to focus on those technologies and literacy of our patients, making sure that we meet their needs.
And I actually think, Gareth, we are seeing some exciting, all of these pieces coming together in, and I know some great examples is Mackay Health Service published some evidence-based research on using remote patient monitoring, and it was with a paediatric population as well as adults. So it was a traditional hospital in the home model, but sending patients home, but remote patient monitoring and using telehealth visits. So Mackay captures patients from 100, 150 kilometres away. So they were able to, safely send the patients home, monitor blood glucose, blood pressure, pulse rates, weights as well, all TGA approved medical devices, Bluetooth integrating in, as well as patient profiling, which was great. New South Wales eHealth has the same solution across some of their health services now and looking to expand that as well. Really, I think, but what's going to be exciting is when we just don't have these pockets addressing either hospital in the home or GP practices, and how can we make it patient-centric and really bring it together? I think that will be the next exciting wave as we roll it out.
I think on some of the questions there, Colin, I think some really good points have been raised. One of them was around the conservative nature of government, but also funding models and other things. I think they're really good points. But I do think that's starting to change. And I think Patricia's example was excellent. And there are other examples in Australia, but also abroad as well. We're seeing these technologies come out in the NHS and other places around the world where they are changing, their more conservative mindset to sort of, to start leveraging these technologies, and funding models are starting to change, not quick enough. And I'd like to see more support for these things, but I do think, we are seeing real value and some of these things being implemented, which is awesome.
I think what is also going to be exciting is I see two barriers. One, we all know as soon as you leave a metro area, you don't have 5G coverage. And I think Starlink has a great place to play there. But when we think about, and particularly, I grew up in central Queensland, so I'm always thinking regional, rural, remote, if it's how can we support those people even more disconnected, but think about how we can connect them as well as from like a Wi-Fi connectivity with Starlink, as well as what devices can they use? Is there a role to play for a lower socioeconomic and repurposing of technology and devices safely into these areas so that they have the basics for something like remote patient monitoring, because that's one of our biggest barriers as well. Our consumers who have the most trouble accessing care, either via distance or socioeconomic factors, also aren't the ones who can afford to have their own devices and data plans or live in areas where they aren't connected. So I think there's a bit of a socialist view we should really take from a funding point of view, as well as the MBS claiming.
Yeah, really good points. And thanks, Gareth, for commenting on that out in the chat. Thanks for making those comments there. So if we look ahead, let's say 5-10 years down the road, what does a digitally transformed healthcare system look like? Who wants to have a crack at that? Maybe James.
Oh, well, we know all of the tools that we'll be using in 5 to 10 years because they're already available. You've got, we already have, robotic surgery. We already have AI analysis of cancer images. We have the remote systems that you guys were just mentioning, but will we be having access to them? That's the thing that we need to kind of work out. And I think one big part of it that we need to solve in order to make that happen is how are we going to get enough staff? I mean, in this country, we already have a massive shortage of nurses. We have a massive shortage of doctors. Our strategy in the past, like other countries, has been to steal them from other countries. But you can't keep doing that. You've got to sort of look at how you're working, and will these tools give us the efficiencies gains that we need, or will they help us train people in the future? They're probably the two things in the 5 to 10 year cycle that technology can have a massive impact on. Is how do we make clinical people more efficient, and how do we train clinical people faster, better, more accurately than we are now? Because the people side of it is the thing that will hold us back.
True. Does anyone else want to jump in there?
Can I just jump in with my dream? In 5 to 10 years, we will not call it digital health, but we'll be back to it just being healthcare. And it will really be something that we've completed that transformational change, that we accept it into our practice. And I think to James's point, we have a long way to go. And I think as clinicians, one thing we really need to start thinking about is, we know we don't have enough clinicians. What are the skills and activities you need clinicians? And then what else can we give up to trust technology? So I think a great, one of the burnouts is just the sheer amount of information we now have in an EMR we can collect in multiple places about a patient. We do a lot more tests than we did 20 or 30 years ago. Therefore, as a person, we have a lot more information to digest, which leads to cognitive overload. That's a great place for AI to play. I mean, I love social media now, where I can click and it will actually give me a summation of people's comments. I love it if, I Google something and it gives me a summation of the points from a variety of websites. Like, I really see AI playing a real role there, where it will help clinician with that cognitive overload or help reduce it. But I think to that point, there are some things that as clinicians we'll have to give up that we need to do and look at technology. So robotics can play, and already is in pharmacy, for dispensing of medications, counting medications, delivering medications. We're significantly seeing robotics there, but can we get to a point that robotics are making beds, doing manual handling, and we're trusting that to allow clinicians to have more of that time, which is the patient, the person-to-person contact, and not some of those tasks that we've traditionally held on to.
I'm going to give a slightly different flavour. I'm hoping that we don't know what healthcare looks like in 5 to 10 years. That's my sort of, fingers crossed, because, for me, true innovation is not about new tools. It's about, and I love this quote, I'm going to steal it blatantly from someone, but it's about new possibilities. It's doing things in a completely different way, because I think if we keep just trying to iterate what we're doing now, we're going to still have the horse and cart, but just with, really slick wheels and, maybe a little bit more. But, we've got to go from the horse and cart to the car, right? We need to have some leap forward in the way we do things in healthcare to fundamentally change things like efficiency and utilization of workforce, other things. I'm hoping in 10 years time we see some really significant innovations, because the challenges we're facing right now, by 2030 we're going to have 10 million sort of a deficiency of 10 million caregivers globally. In Australia, we're going to have, by the end of this decade, we're going to have 100,000 deficient nurses and other things like that. We've got to think differently. We've got to try and take some big leaps forward. That's what I'm hoping. I'm hoping in 10 years time it's completely different.
Yeah.
I'm just going to be the little old lady in bed saying, back in my day as a nurse, we had paper medical records.
I'm just going to look at the chat again. Is the conservatism to tech coming from an unfair reliance of the health or care service to understand and manage the safety and quality risks in technologies? And if so, is one solution about enabling technology delivery organizations to take a healthcare approach to safety and quality analysis, clinical governance, to ultimately speak the same language as the health or care organization?
I mean, that's an interesting question. I mean, healthcare is a safety critical industry, right? So, we're never going to sit there and just throw innovation left, right, and center into healthcare, because, we do have patients in our hands, and we're not going to take significant risks. Airline industries, nuclear power, other industries, treat innovation in a similar way. They are conservative, and they, take great, they take great care in the innovations they introduce. However, we can't, as Patricia said, we have come a long way. We are moving, and I think we can, continue to evolve and innovate going forward as well. There's a lot of money that's going into digitization and digital healthcare, and I'm hoping that we see some really significant innovation. I'm excited. I think we can. And when you look at even when you look at the differences between private and public healthcare in Australia, you're looking at 20 years difference in digital capabilities. To be honest, I would argue private healthcare is 20 years behind the public sector. So I'm hoping we continue to. I'm hoping the private sector lifts their game and catches up, and I'm hoping the public sector continues to move forward and continues to invest.
And can I just add an observation around that clinical governance? I think if I reflect on my career, when we first started in digital health, the risk management around IT was totally different from the hospital or the healthcare risk and quality meetings, and there was no overlap sort of between the two. And I think we've shifted a long way now to sort of bringing them all into one and understanding that, from a patient safety, quality, we actually have to have our technology, our innovation all coming to that same governance committee and that same understanding. So I think it has shifted, but I think there's still, and what we're improving, and Liz is one of the great people waving the flag, is having people in these committees with clinical governance also understanding the technology. And I'm seeing it increasingly with vendors realising that they need to have some clinical governance around their product delivery and their solutions and the products that they're delivering as well.
Great. I can see some more chat here in terms of absolutely agree with you, Patricia. We do have the tools and systems in place, but with ongoing shortages of clinicians and nurses, what are the alternatives? How can we realistically deliver the service in that context? And with increases in digital health and technology and its usage, where is the line between old-fashioned clinical judgment and any liability that may ensue from digital reliance?
I'm happy to answer that, Colin, if you have.
Yeah, perfect. Thank you.
Yeah. When with clinical decision making, and we use AI clinical decision support tools, and the advantage is that you've actually got higher governance as such, in that we can monitor, agreeance ratings, say, so where they're agreeing with the output of the tool, the nurse, they're empowered with their own clinical decision making. But where we know the limitations of telehealth, and I think that's an evolving space in terms of governance and inclusion, exclusion criteria for pathways for, say, virtual EDs. What's appropriate to go to an emergency versus what can be triaged in a virtual environment, and what's appropriate for a nurse, and in terms of their decision making and that autonomous decision making and the software it's supporting them in that decision making. So we have a clinical governance framework that extends to virtual and digital health organisationally. We have an auditing framework as well. And then the use of those decision support systems, whilst they are there to support, it's really driven by the nurse. And again, that's in terms of machine learning, that inference engine and population health data, again, is a dynamic, and we see that engine improving and that feedback loop. But that's where it extends to investment is the evaluation of these technologies. So whilst there's investment in technology, there has to be the investment in having an evaluation framework to be able to justify the investment in these technologies and identifying the risk and what mitigation do we have in terms of the overarching governance organisationally.
Well said. Okay, I'm conscious we're coming up to almost 45 minutes at the moment. Does anyone have any additional questions?
Can I just jump back into the question from Shawanthi, but just around ongoing shortages of nurses and clinicians and what can we do? I think with technology then, and we saw this a lot during COVID, I think there's a lot of real interest in how we can, as clinicians, think our delivery of care, because we still tend to think of nurses and doctors having to go into a hospital for an 8-hour shift, or having to go into the office to do their telehealth appointments from the office home. So, I think there's a capability for us to think around, what that can look like. Can we have, staff working half of their shift in the hospital manually on the floor, but then half of their shift providing telehealth or hospital in the home remote patient monitoring services, so that not, as you get older, an 8-hour shift on a busy ward is physically taxing. So, I think that we have, in the way we deliver care, we can start just, there can be changes in just our thinking around the 4 bricks and mortar walls and these new models of care and hybrid approaches, and thinking about clinicians as well. I mean, a lot of us on the call probably are lucky now we have the opportunity to work remotely from home or work from in the office, and, thinking about our aging clinical workforce, I think if we start thinking of opportunities to safely deliver care for those clinicians, we could actually keep a lot more of our clinicians engaged in the workforce potentially for longer. Just one idea I'm throwing out there. But yeah, I do think that, there are opportunities if we start thinking outside the square.
Great, thank you. Yeah, look, conscious we're coming up to 45 minutes, unless anyone from the panel or from the audience wants to add anything else.
Just one quick thing, Colin, and I think, we didn't mention it, but I think, it was one of the points that the audience may have been interested in. It was around retention of staff and what are some of the opportunities that are going to come up for roles. What are the new skill sets that people are looking for? I just wanted, people to be aware, being involved into some really large and complex digital transformations. One of the things that, I talked about the success, which, we all raised, which was really good around sort of the culture and then the governance and then the skills. But what are the skills that help the transformation and help organizations embark on innovation projects is informatics was it's not that new these days, but I just wanted to highlight that informatics is such a critical skill set, and for me it's only really effective if the person in that role is a clinician or has been a clinician. It's core to these programs being successful, but it's core to organizations being successful, I think, just in day-to-day operations as well. It's a critical part of the team. And I think that, nurses have this and physicians have this wonderful sort of career path that can divert them into the digital side, which is really exciting. I recommend, I hired a nurse as my director of clinical informatics in the UK, and she was a nurse manager and brilliant in the role. I recommend any nurses or allied health professionals or other caregivers to get involved in digital transformations your organization are doing. Just being part of that program gives you that insight into how these initiatives are run and how they function, and potentially may lead you up a path of informatics or a similar type of role, which is, for me, it's an exciting space to be, and just I really see that as a great opportunity for people in the clinical space.
Thanks, Garrett. Okay, I think with that, we'll wrap up today's webinar. I want to thank everyone for attending today, and thank you to the panel for taking part. We'll follow up with the webinar afterwards and a few ebooks, etc. And feel free to reach out if you have any questions. Thank you, everyone.
Thank
Thank
you.
you.
Thank you.
Thank you, Colin.
Thank you.